We have all established the fact that for drugs to actually cause red blood cells breakdown, they must actually form complexes with antibodies. All right. So we got to see that some patients, when they are undergoing some different types of medications, these medications are kind of like harmful to the body, and they might cause breakdown of red blood cells, and that's what we call this hemolysis. Okay. So we are just trying to look at the immune complex that is formed that will start inducing this breakdown of red blood cell. Okay. So on that basis, the title of this lecture is what? Immune complex mechanism of drug-induced hemolytic anemia. Right? Like I just you guys should look at here. You can see that drug antibody immune complexes. All right. So now this drug, for it to actually break down the red blood cells, it must come to the membrane of the red blood cell and form some bonds with the antibodies that are found on the membrane of the red blood cell. Okay. So on that basis, we'll be looking at this mechanism, how this complex is formed to start initiating this process. Okay. So drug-induced hemolytic anemia, also known as drug-induced immune hemolytic anemia, is a rare cause of hemolytic anemia. All right. So it is basically difficult to differentiate it from other forms of anemia. Okay. And this can also actually contribute to delay in diagnosis and treatment. Because see, there's one thing here that you guys should note. Hemolytic anemia is hemolytic anemia. All right. Breakdown of red blood cell. Okay. Basically has the same features. All right. Just some few things kind of like differentiate, and if you know them, you basically get to know about the etiology. That's the causes. All right. So many different types of antibiotics can cause this drug-induced autoimmune hemolytic anemia. Okay. And basically, if you want to treat a drug-induced hemolytic anemia, you stop giving the patient the drug. Okay. That's why we say that discontinuing the offending medication is the first line of treatment. Okay. So this drug-induced autoimmune hemolytic anemia has been estimated to affect 1 to 2 people in 1 million people. All right. So 1 to 2 people per million worldwide. Okay. So if you count 1 million people on a random, at least 1 to 2 of them should have this drug-induced hemolytic anemia. All right. So let's talk about how this complex is formed. The drug forms complex with plasma proteins, and this will lead to the production of drug-specific antibodies. All right. They say antibody to drug, right, to bind it to all those plasma proteins on the membrane. Okay. So now reintroduction of the drug. That's if you have a second exposure. You know, when you have first exposure, it's kind of like mild. Second exposure causes immune complexes to form, which are adsorbed onto the cell membrane or onto the red blood cell membrane. Okay, with complement activation. What does it mean? This means that once the blood forms all those complexes, all right, they are attached to the membrane, and this is the factors that start weakening the membrane of the red blood cell, making it vulnerable to being degraded or lysed. Okay. So severe intravascular hemolysis may occur with fever, rigors, or nausea, and also acute renal failure. So this will tell you guys that this drug-induced autoimmune hemolytic anemia, the breakdown of blood is intravascular. That means it happens inside a blood vessel. Okay, so this is just how the mechanism actually takes place. Right. So see you guys pretty soon.